when people are getting rehabbed, if they have any sort of pain, exercise is always one of the top things that they have to do to make themselves better. And so if you just crack people all day and adjust their spines, I don't want to see the same people over and over and over. I want them...
The same condition.
Yeah, I want to empower them. And part of that is, well, you know, we need to have a physical therapist. And
hey, Dr. Chris Google's here with the Health Heroes podcast, and today we have a special guest, and we have a really cool location. So we have Dr. Trent Artichoker, and I actually met you when I was just looking online when I was getting out and letting everyone know about ScolioCare, and I walked into your office and like immediately saw all the photos and everything. So I was very impressed from the first time I walked in. Plus, you guys got a great online presence and tons, like over 400, you know, maybe it was over 1,000. I don't know.
Oh, we got over 1,000.
Yeah, 1,000 like great reviews. So anyway, excited to have you on the show.
Cool. Appreciate you having me. I really look forward to talking to you and getting to know you, and I appreciate you reaching out.
Yeah. So we were just kind of chatting about how you got started, but first, how did you get into chiropractic initially?
Oh God, it's kind of a long story. I had a crazy issue with my leg growing up. I had my leg didn't grow as fast as the other one. You know, I just got dealt a bad deal, a hand of cards, and so I was short 2 inches.
Oh wow!
On my left leg, and so when I was a kid, gosh, you know, I have to go to the doctor and they would do X-rays to check on my skeletal system, and yeah, sure enough, I'm short, so I had to wear this shoe that had a lift on it. I couldn't stand this shoe. I was so conscientious about it, and so it just made me feel really crazy, and I would intuitively crack my back. I would sit there in class and just, you know, pop it, and I'd have to do everything, and so I ditched that shoe. I was too self-conscious about it, didn't like it, so my pelvis was like this, and so my spine was perfect scoliosis spine.
Yeah, just the short leg developing a scoliosis.
Yeah, and you know, that's what I see a lot in clinic too. When people show up with a short leg, sure enough, their spine is like this.
Yep.
And so it's something that I've definitely honed in on over the years. But long story short, I had to get surgery, and so I had an orthopedic surgeon. He literally cut my leg in half. He cut my tibia and fibula right in half, and he left the periosteum on, and then they put this external fixator on called Nilizarov, this Russian device. And on this device, I turned these knobs 4 times a day, and I got 1 millimeter a day, and it lengthened my leg 2 inches.
So it was a procedure where they actually lengthened your short leg, not reducing your longer leg. Yeah,
and that was an option too, of like, do we reduce the short one? And I was like, well, I'm already short enough. Yeah. I need everything I can get. And, and nowadays, oh my gosh, the people are doing this to become taller. And so they'll put it on both legs, and I think you can get like 6 or 8 inches out of this stuff.
Wow.
Which, height goes a long way with people, but health goes a longer way with people. And so the crazy thing is that when I had this imbalance, it gave me the craziest, most intense, severe migraines ever.
Really?
I had the craziest headaches where my mom would have to, she would massage all my pressure points and trigger points, and then I would just kind of fall asleep. And so got the surgery, all the headaches went away.
Wow.
And then I got adjusted, and blew me away how good it made me feel.
Were you in high school? Or
this was in college. I was adjusting myself, before the surgery, and so I had to do kind of just a lot of self-correcting. Then I had to do a lot of physical therapy too, and so initially I thought I wanted to be a physical therapist after going through all this crazy procedure. But the procedure changed my life. It made me feel, it gave me the perspective of how important symmetry is.
Yeah.
And so if things aren't, the spine loves symmetry. If you're not balanced from left and right, and even forward to back, there's going to be some struggles. There's
Absolutely.
one piece of the tissue, whether that's your neck or your nerves getting entrapped, or too much pressure on some of the joints or the discs, you're going to get a lot of pain.
Yeah. So when you were done with the procedure, how close did they get your legs and sacrum to being like your sacrum level and the legs the same length?
That's a good question. I think I'm pretty level. I haven't done much follow-up, as far as like doing some other x-rays, and I feel like I'm pretty level, but I had an imbalance, an inch short in my femur, an inch short in the tibia. They put the 2 inches in the lower leg. And so my knees are a different height. And so I had to learn how to walk again. And so that led me down the path of just wanting to learn more about the body and how it worked. And so I have to keep this leg strong, so I have to do a lot of rehab and try to make it fun as possible. So I snowboard a lot and try to make exercise fun. And the whole process is very trying on somebody.
Yeah.
And so I have a lot of compassion for people out there that are going through the same kind of stuff, just problems with your body. And I know what it's like. And so I think if you can improve the quality of people's lives, I think that goes a long way, and just kind of helping yourself out too.
I think that it's one of the things that I see is hard for sometimes young practitioners that haven't been through anything or struggled enough. It's hard to have that natural empathy. I mean, I was an athlete myself in college and wrestling, and that's how I got into chiropractic. I hurt my spine. But I think that there's a blessing if you're someone that takes care of people physically, if you've had your own thing you went to, because you understand things from their perspective.
Totally agree. Couldn't agree with you more.
It almost hurts you if you've never been through something yourself.
Yeah, and I always wonder. It's like, of all the doctors out there, and chiropractors, medical doctors, DOs, whatever. It's like, what got you to this place? Was it the
it's the hero's journey,
actual?
Right?
Yeah, was it the extra initials behind your name, or was it because you had some sort of issue growing up, or just some issue in your life that you had to overcome, a struggle? It makes for a perfect book, right?
Either yourself or someone close to you that you had to help overcome something, I think makes a big difference.
Yeah, if you can relate, it definitely helps. And it's, more importantly, it's given me the drive to continue to learn. I've been out of school for almost 20 years now, and to this day, I am always wanting to read more information, absorb information, learn more about the body.
Yep. One of my mentors that I got introduced to right away was Dr. James Chestnut, and he talked about just having that. Someone asked him, like, how do you have this natural thirst to keep learning? He's like, there's just so much to learn. That if you're not innately just fascinated and don't have a drive to get up and want to learn something every day, it's like you're in the wrong field.
Absolutely. One of the first books I got was a Netter book, a human anatomy book, because I wanted to understand what I was going through.
I still think it's fun to look through those.
Oh, absolutely. You look through this and it's like, oh my gosh, this is amazing that the body is so dang complex, but yet works.
And so intelligent.
Yeah, it is always trying to heal itself.
Yep.
We just have to give it the right environment, and that's why I have a hyperbaric oxygen chamber. That's why I have a red light bed. That's why we do shockwave therapy. That's why we have a physical therapist. That's why we have a physician assistant. It's because people need a lot of different types of doctors and different kinds of therapies.
Yeah, you guys have a lot of things that you offer here, all focused around natural healing, but it's not how you started out. Because you mentioned that you told me you came here, you rented a room. Tell me about your process of coming out of school, starting in practice, and then how it's evolved over the years to where you have now.
Gosh, that's an intimidating process. I got a bachelor's degree. Took me 5 years to get the bachelor's degree. And then after that, I applied to medical.
Super seniors, we're in the super senior club.
Right, I was kind of like the oldest one in like all of my cohorts. And so I was also a teacher beforehand. And so I taught for 5 years. I taught chemistry here in Denver. And so that was actually fascinating. I was prepping myself to go to medical school, and I wanted to increase my communication skills. And so I taught, and then my wife graduated, and then it was my turn, and so I got a master's in anatomy as well, and then I went to chiro school. And gosh, you come out of school with just a tremendous amount of debt. I had $200,000+ of debt, and
you have a lot of education, but you still barely know what you're doing.
Oh yeah, it's like I had 10+ years of education, and I didn't have a nickel to my name, and I just had debt. And I didn't come from a silver spoon family, and so kind of had to hustle a bit. And so I rented this room from another.
The one we're in right now.
The one we're in right now, but there was wood paneling on every wall. I bought a table off of Craigslist. I reupholstered the table myself. My wife's father gave me just a little bit of money, so I bought an electric stem machine, I bought a massager, and then I listened to people, and I treated them as much as I could. But I knew that, and I got a lot of people better, but I knew if I okay, maybe if I had like a flexion distraction table or like a decompression table, I can help another segment of the people that are coming to me. There's so many disc injuries and like these people. One of my patients, she's been coming here ever since first month. And so 17 years as a patient, she's been coming every single month, and her spine is like, she's got at least 40 some degree curves in her spine. But she's been really good with her maintenance, and she takes care of herself with good quality food, and she exercises a lot. And so, I'm just kind of helping her along the way with coping with this crazy thing that's happened to her spine. She got dealt a bad hand of cards too.
Yeah. When I was starting out, when I was starting to do chiropractic biophysics, I couldn't afford any equipment. And I'd go online and I would find guys that were selling it. Sometimes there were guys that were retired, they're going out of practice, and they'd be showing me their storage shed, and I'd be buying things, that's all I could afford. And I'd go to a seminar and they'd be like, oh, this is a great textbook, it's $90. I'm like, oh, I don't know.
Yeah.
I would stress over it so much.
I know the feeling. I struggled too. But I always put...
There's a gift in that, though. I think my wife's an orthodontist, and she came from Russia, and we were both talking about it makes you hungry, and also like when you come from real humble beginnings, I think you value people when they come in, knowing that they've worked for every dollar, so you really want to deliver when they come in. But I think that makes you hungry to keep growing and learning and advancing too. If it's too easy when you start, I don't know.
Absolutely, and I have that struggle with my own kids today. It's like I could provide for them whatever they need, but I want them to work for it and get that feeling of what hard-earned work gets you. Because there's some value in that too, of just actually paving your own path.
Yeah. Plus, you look back, and I think that's where the enjoyment comes. When you've seen the journey you went on, and then that, I think, is what gives you satisfaction. If it was just, if you had your dream practice on day one, someone gave you the keys and you didn't have to create it, one, I don't think you would sustain it. No. But two, you wouldn't have the joy of what you went through to build it.
You'd probably drive it into the ground. Because all the learning lessons it takes to open up a business, you know what it's like. Yep. There's quite a few people that I went to school with that are not even chiropractors anymore. It's insane to spend that amount of time and that amount of money and then not even be in the profession. And I think it kind of goes back to, it's like, well, why did you choose that path to begin with? Was it the allure of the doctor title or potential financial gain? I think it takes a lot of work to make these things happen.
It does. And then one of the things I know that you're well known for is you treat a lot of athletes. If you go down your hall, you see you have a lot of athletes on your wall, professional football players, you have a lot of people in the MMA community. So how did you start to get into that niche? And then you have some advanced training with sports chiropractic. I know you're elite, ART. Can you talk about like what sets you apart in that just stance in your training to treat athletes, but then how you got involved in treating athletes and kind of some of your niche there?
Luckily I went to a school where they had an elective program to treat people at sporting events. And so the first event we went to was a kite surfing event in Portland, Oregon, and in the Columbia River, where these people are on these kite boards, and they're
I wouldn't think about the Columbia River being out there, kite boarding, but
people are in the water.
It's pretty like a turbulent, fast-flowing, muddy river, right?
Yeah,
I know they're famous for sturgeon fish.
And so we go out there with the professor, and we set up several tables, and sure enough, people want work done. The sport's hard on their body. Some of these people are getting launched 20, 30 feet in the air, and they might go 100 feet in the air and then land back in the water. And some people don't make the landing. And so very hard on the body. And so after that, I did probably a dozen more events, and from wrestling tournaments to volleyball tournaments and bouldering events. And then so I graduate chiropractic school, get this place, I reach out to any sort of sporting event that I could. So I was doing triathlons, 5Ks, and then I got into a jiu-jitsu tournament. And not surprisingly, but there's a lot of people getting injured in jiu-jitsu tournaments.
Yep.
And
I bet. I have a friend that's a black belt on it, and I wrestled in college, and I was gonna start jiu-jitsu, and he goes, just so you know, you're gonna get hurt, and it's not that you're gonna do something bad. He goes, there's people that don't know what they're doing, they're gonna hurt you.
yeah, and so I think it's hard to do. It's hard to do any sport and not take the brunt of it and pay
Especially
the toll.
as you get older.
Yeah, and and that goes the same thing with the desk jockeys too. It's almost just as hard on the body. Just sit there in front of a computer all day, or
Probably harder.
or be on a plane every single
Yeah.
week and traveling and sleeping in different beds and going through all the different pressure gradients on it's hard on the joints and the body. And so I liked being out of the office atmosphere and being one of the team members. Growing up, I wrestled, I played football, I did basketball, I played baseball. I was a very athletic kid, and I had a bunch of struggles too because of my imbalances. I got this crazy IT band syndrome, and the solution was to stick me in a cold tank. that was the athletic trainer's solution.
You're ahead of your times.
Right, I was actually kind of smart, but God, that was hard, and it didn't really fix it. It didn't fix it, and so I really love enjoying working with the athletes because it feels like I'm part of the team, and when they win, it feels like a small win for me as well. And I know a lot of these guys can't do what they do without a person like me on their team.
Yeah, when I wrestled in college, 4 of the guys I wrestled with ended up going to be chiropractors because we had the athletic trainers, we had physical therapists, and they served a certain niche, but then we needed someone that could give adjustments. And so our coach would send us on our own dime. We would just go see the chiropractor, and before you knew it, half the team was just going to someone just to get tuned up because the chiropractor could do something that the other providers couldn't.
Yep. Yeah, we definitely feel a very unique niche out there. I mess around with the hyperbaric and the red light and the shockwave, but our true art is adjusting the spine. That's what always brings me back. It's like, how are we reducing that nerve interference to make the spine and nervous system work better?
Yep.
And that is the true art, because anybody could stick a person inside of a chamber or a red light bed or put a shockwave probe on somebody. But when it comes to really knowing how to adjust somebody, my God, it's an art and a science. It is so difficult, and I think that's why a lot of people of my school cohort are not chiropractors anymore, because it's too difficult.
It's something that takes constant focus and work on to master. And I think it's when you've been worked on by someone that's a real master at adjusting, like you can tell the difference. A lot of people are just so. I had a young associate out of school where they learned to adjust digitally during COVID.
Yeah.
And I'm like, man, this is like work. It's work and it's like focus. And if you think after 2 or 3 years you're good at this, like you just don't know. Like,
during COVID, one of my interns, they were practicing on teddy bears in school because of the whole COVID issue.
Yeah.
They couldn't go to school. And so, how good are you going to be when you're practicing on
it is
stuffed
it is
animals
a skill, and it's something that I think you have to have a certain amount of, I don't know if athleticism is the word. You got to have something about you where you know how to control your body and have body awareness, but it does take practice. It's like a martial art. It takes practice to develop.
It's the hand-eye coordination. And how much have you been exposed to that while your nervous system was developing, going through adolescence and into adulthood? And so luckily, I did a lot of athletics. I had 2 older brothers that always dominated me with everything. And so I knew that going into athletics wasn't my forte. I was never the biggest, strongest, fastest kid, but
I thought I was going to be a running back for the Cincinnati Bengals, but apparently there's not a big need for 150-pound, 5'6" slow white guys in the professional athletes.
I totally feel the same. I knew right away I needed to use my brain, but also use my hands. It's a great profession. I don't got to sit and stare at a computer all day. I get to meet a lot. Gosh, I've met a lot of people in this city, and so it's really fun to actually when you're out of this environment and then you run into patients and they're just so happy to see you, and they it's like all the reviews that have been left that's something I really take to heart, and I'm really grateful to being a helper in somebody's life, to make their life a little bit better.
So speaking on that, do you have a favorite patient like chiropractic story, or one that really sticks out in your mind?
Oh boy, I think it's probably has to do with the whole short leg deal. I like helping everybody, but when a person has been to a bunch of doctors and they haven't identified that this person has a short leg, I think that really hits home for me, because it's actually kind of a simple fix.
Scoliosis Denver, we see this all the time.
Yeah.
And the amount of times it's never even been checked or looked at is like mind-blowing.
Right. And, we're in the profession where if the pelvis is off, the leg lengths look different. Mm-hmm. And sometimes a lot of times that is the case, but sometimes there's actually a short leg.
Anatomical short leg.
Yeah.
The bone's not as long.
Yeah, so anatomical
short
leg.
You can't adjust the bone to be longer.
Exactly, and so, but a lot of times the people have been kind of fed this information, and it's like, well, yeah, your pelvis is trying to compensate for a short leg, but you actually do have a short leg. And so, I have a digital X-ray system here, and it's so awesome just to take a picture, look inside a person. Mm-hmm. And then say, oh, your pelvis is like this, your femur head's here, your other femur head's here, and let's get a little bit better look at an understanding of the actual lengths of your legs. And so then we'll do a bone X-ray study and get to the millimeter the length of the limbs. And then from there, it's just putting some shins inside of the shoe and doing some really high-end treatments to make sure the body adapts and compensates well. So those usually turn out to be really good stories, because people have gone to so many doctors in the past and been the person hasn't been identified as having a short leg. Mm-hmm. And so, but then once you do that, people get better. Then they're all of a sudden more active, and they're happier, and their lives literally change.
Yep. That's one thing at Scoliosis. Someone asked me, why did I get him just doing that? I'm like, we were just able to give people help where no one else could. So even though it's hard treatment and it's complicated, it's very rewarding too.
Yeah.
One of the things we see at Scoliosis a lot of times is people that come to us when their cases have gotten really severe. And although we can still help them in a lot of instances, I always think, man, if we could have got this earlier when the problem was smaller, how much even better could the outcome be?
Yeah.
And I'm curious, where do you see that in your clinic? When people come in and you think, man, I could still work with you and help you, but if I could have got this when it was a small thing, this would be a lot easier.
Oh, absolutely. I'm glad there's guys out there like you that are specializing in scoliosis, because it's a very difficult condition to treat. One of my first patients doing the sports event elective in Chiro school was it was a marathon. And this lady shows up in the medical tent afterwards, and she's like, well, I don't know if you're going to be able to do much with me. I've got rods, Harrington rods, all the way down my spine. I'm like, well, I can work on the muscles a lot, make you feel better. But, a person like that makes me wonder. It's like, gosh, if we would have gotten to that person a little bit sooner, would they have been able to avoid getting Harrington rods and then the associated conditions that happen because of those rods?
Yeah.
You get the advanced, adjacent segment disease.
Yep.
And so, I've had one patient sticks out in mind. She was in her mid 60s, and she shows up in here, and when she was in her 50s, all of a sudden she got the bug to be really active and be healthy. And so she changed up her diet. She started running. She completely changed her life, but she had a lot of hip and back pain in the process.
Especially when you go from sedentary and you start moving your body.
Mm-hmm. And then so, sure enough, we do X-rays on her, and she's short about an inch on one side. And so I'm like, well, this is the recommendation. We have to put an insert in your shoe to level out your pelvis. She didn't want to do it. And then she shows up a year later, and then she's got a hip replacement.
The number of people that have fought me over just a simple shoe lift, I'm like, yeah, it's a little bit, but it's better than having, a chronic back pain or something, or having a hip replacement. And you see people that they have a short leg, so their body's over to one side, and they have knee problems, knee arthritis, hip problems, and no one's actually looked at them to go, oh, you're leaning to the left because you have a short leg and you're just carrying more physical load on that side. It's like, got to look at the whole body and look at the whole person.
Absolutely. And so, there's problems that come with surgeries. A lot of the patient that I was telling you about earlier that still sees me to this day, she will not see an orthopedist for a hip replacement. She needs a hip replacement. She needs a knee replacement, and she needs a lot of advanced scoliotic care. But some people are just so dang stubborn, and so she's one of them, and she's in her 70s now, and so I kind of wish I would have met her when she was in her 20s, and then sent her to a guy like you to help, so you could help her fix her spine, and then also help preserve the joints. If you can't preserve the joint, the integrity and quality of that tissue, you're gonna need a replacement. A joint can only go so long, whether that's a spinal joint or a hip joint or a knee joint. And so some joints you can't replace.
What's interesting is even in our own profession, there's different specialties. Like when I never really treated infants. So when I had a baby, I told my wife, like, hey, we're going to a person that specialized in pediatrics. And she's like, well, they kind of checked everything at the hospital. I'm like, no, like this is different. And some of my friends are like, why aren't you adjusting her? Well, I will, but I've never adjusted 1 week old, so I haven't done it like all the time. So I'm going to go to someone that I know is really, really skilled at this. I hurt my knee. You do athletes. I was training for an Ironman, and I have a patient that I help with neuropathy, and he's like a professional kind of level cyclist and triathlete, and he's like, I'm going to take you cycling and give you some tips. And we were going, and he's like, by the way, do you notice your left knee goes out? I'm like, you know what? I was noticing that, and I'm starting to get some pain. Well, I had a tight hip, and I developed a tracking problem that I noticed after the triathlon. And I had to go to specialists. And finally, I was at a seminar. I have a buddy he's a chiropractor for the U.S. track and field team, but he was very elite at ART.
Yeah. And
he worked on me, and we were literally having cocktails at a happy hour afterwards. And if I didn't have a couple on me, I probably couldn't have taken the treatment because it was so painful. But I had to go to see, I saw someone, I didn't know about you, but he sent me to someone in downtown Denver that just did ART. So I go to different chiropractors all the time that do different skill sets and different specialties.
Oh, it totally makes sense. Some chiros out there, they specialize in COC1 area, just a couple vertebra, and very high tech and very sophisticated analysis of how they realign those bones and taking pressure off brain stem and all the nerves that exit out of that area.
My wife had to do that after she tore alar ligament. The ADIO stuff,
right? That's a major ligament to tear too.
Yeah,
oh my
she
gosh.
had to do stem cell through there, and that was like the one thing that would give her temporary relief.
Yeah, and it brings me back to how complicated the body really is, and how can one person treat everything that goes wrong with the body? No, you need a guy that knows how to do scoliosis. You need a guy that a headache guy. You need a knee guy. You need a shoulder guy. You need an ART guy, and so. I've always had that impression of there's an abundance of people out there, and all of these people have so many different kinds of conditions that they do need a team to work on them. We do need a physical therapist here. We do need an acupuncturist here. We do need several chiropractors here. That one that treats pregnant women and does perinatal care and.
Yeah. So talk about your team. Talk about you built quite a big team. I know you have several chiropractors, but you have a pretty cohesive team, and you guys work on the same kind of problems, but you approach it from different angles. So talk about your team and kind of what kind of a healing experience you think that gives people when they come here.
I think I would have a hard time if I was doing all of this myself.
Go crazy.
Oh gosh, it's too complex. So, we had a chiropractor here once where she really loved the nutrition aspect of a person's health journey, and that's because she had a lot of same kind of thing. Her origin story was a lot of poor nutrition, and so she got a lot of education in nutrition. There's 5 of us chiropractors here. We're all a little bit different. Dr. Laura, she specializes in perinatal care and also in adolescent stages of the musculoskeletal system, and so she sees a lot of kids as well. But we also have a physician assistant. So when people experience whiplash and other kind of traumas through car accidents, is that we do have that gateway to any imaging or different kind of specialists that people need. And so, and we also have a physical therapist. When people are getting rehabbed, if they have any sort of pain, exercise is always one of the top things that they have to do to make themselves better. And so if you just crack people all day and adjust their spines, I don't want to see the same people over and over and over. I want them
the same condition.
Yeah, I want to empower them. And part of that is, well, we need to have a physical therapist. And so,
which is completely different than going to a place that everyone gets the same exercises, same routine, same home care. It's like you gotta get treatment and rehab based on what you need.
Yep, it comes back to treating the whole body. And so, what does the body need? It needs good nutrition, and so we have a person that does nutrition. It needs rehab, so we have a person that does physical therapy. Sometimes the brain needs treatment, so we put people in the hyperbaric chamber to help regrow their axons.
Yeah, so talk about the hyperbaric chamber, because I know they're used to basically saturate, in a simple layman's words, basically highly concentrate oxygen in your body. Is that correct?
Yep.
And I know it can help with recovery. I know people that have used it for other diseases, like people that have cancer use it because cancer doesn't survive well, or a lot of pathologies don't survive well in a high concentration environment. But talk about like what you guys use it for here and what brought this in.
Well, when you start reading the research on hyperbaric oxygen therapy, you soon realize that it's the answer to a lot of different kind of conditions. The commonality between people's pains is that there's a wound, some sort of wound in the body, whether that's a ligament that has torn, or a muscle that's torn, or axons that have been torn. The body responds with that additional oxygen to help heal the body. The pressure changes also trigger some important physiological processes too. It induces a hypoxic induction factor, HIF-1 alpha. In 2019, 4 guys won the Nobel Prize for figuring out that when the body is exposed to different pressures, a changing pressure, that induces this hypoxic induction factor, which ends up as a transcription factor that goes and talks directly to the DNA and tells the DNA, hey, we need to start making a bunch of stuff here to heal the body. And so, it produces stem cells. One treatment in a hyperbaric oxygen chamber increases your circulating stem cells by 200%.
I didn't know that.
After
200%.
200% increase in circulating stem cells, and those are progenitor CD34 plus stem cells, and those have capability of turning into a variety of stem cells, primarily VEGF, vascular endothelial growth factor, and so that helps stimulate the body to produce new blood vessels.
And that goes along with what you do with the red light therapy too.
Absolutely.
And then also with your shockwave therapist, the shockwave therapy, which is known for stimulating angiogenesis and circulation, but also the red light therapy too.
Yep. And this whole thing of like, how do we fix a body? Well, we need to regenerate the tissue. As an adult, we have a really difficult time regenerating that tissue, and so a lot of times it's scar tissue. You tear a muscle, and how well does that muscle heal? Or you tear a ligament, or you tear a tendon, and so.
And a lot of those tissues, they already in nature they're very avascular, so they don't have a good blood supply. Especially you get some of like tendons and ligaments, things that do not heal. It's like bone heals great because there's a great blood supply. You can heal bone in 6 weeks, but soft tissue injury can be permanent. Right,
and that's, we see a lot of disc patients here. I was so surprised coming out of school and starting practice of all the disc injuries that came in here.
In school, you're scared of it. You have the term hot disc, and you're always worried about it. And then it's like everyday life. Remember?
Exactly. Right. I know. It's like we'll get almost 150 new patients every month.
That's a lot.
And our top number is almost 200 that we had in 1 month. But at least half of those are disc patients. And so the nucleus of the disc, the body has never seen that as it's gone through maturation process. And so once that nucleus has migrated into the annulus of the disc, it's the most inflammatory thing that the body has ever seen. I've read 10x inflammatory compared to any other thing that the body experiences. So yeah, hot disc, because that stuff is extremely inflammatory. And
Which is why you can give someone an injection and get some temporary relief, because it's just shutting down the inflammation, but it's not actually healing the person,
Right.
and actually long-term harming them.
Exactly. And so yeah, a lot of these steroids, they're chondrotoxic. You know, you start injecting steroids into joints,
Degrades the joint.
it degrades the joint.
Degrades the ligament.
One injection into the knee joint will increase your chances of total knee replacement by 10%.
Say that again.
Yeah, one steroid injection into your knee joint will increase your chances of a total knee replacement by 10%.
And how many people get 2 or 3 of those things?
Oh God, it's so common. It is. I mean, it's kind of it's the other side solution, you know. And so, but you know, that's not quite true. You know, there's a lot of great minds out there that are using stem cells and trying to harness the power of the body's innate capability of healing. The body always wants to heal. You just got to give it the right environment. And so, yeah, I got a hyperbaric oxygen chamber, for one, to treat myself.
It's funny. A lot of things we have in our practice come out of my own desire to fix my own issues.
Yep. And so, you know, I still got plenty of issues, and I got imbalances, and I'm always working on trying to better and improve myself. But yeah, you got a disc that's torn, that's ripped or protruded or extruded. How do you handle the inflammation? How do you handle the healing process? The chamber is perfect for it. And so it'll help improve interleukin 10. It'll help upregulate interleukin 10 and downregulate interleukin 1, pro-inflammatory and inflammatory immune markers. And so if you can decrease the inflammation naturally and improve the regenerative capabilities naturally, why wouldn't you do that? And I think a lot of it, people just don't know about these things.
Yeah, it's nice that you guys provide great chiropractic care, because when I integrated my practice, I remember it was a husband-wife PT chiropractic team, and we had a lot of things we were bringing in, and they said, you know, the one thing you keep in mind is your chiropractic is your secret sauce, and that's really going to be the main thing that's going to really help. But there's all these adjunctant things that you're going to be able to provide that's just going to enhance what you're doing at a chiropractor, that if you're just doing adjustments, it makes it much harder to help people too.
Yeah, and that was my whole deal, starting practice and learning kind of the hard way. And you know, I had one table and I could help this many people, and so I got a different kind of more sophisticated table. I could help this many people. I got a shockwave device. I can help this many people. Hyperbaric, you know, it's all the, you know, everything else that
you've added tools to your toolkit, but they all align with the same natural healing philosophy.
Yes, it has to align with the body's natural healing capabilities. And I think if you feed it the right things and tackle nutrient deficiencies and put it in the right environment, it's going to heal itself. The body is always wanting to heal itself. But you can't eat hot Cheetos and drink Mountain Dew and expect your body to heal from that.
My wrestling coach always told us you can't make chicken salad out of chicken shits.
Exactly. Right. Yeah, you are what you eat kind of thing.
Yeah. So, you know, if you, as a person out there watching, I guess if you could give just one overarching piece of advice to a person out there that's, you know, maybe never been to a chiropractor, or they're dealing with some kind of physical problem and they're not sure what to do, what kind of advice would you give someone? Or just someone like advice about taking care of yourself for the long term?
Yeah, well, gosh, you know, now we have GPT to ask. I have a 16-year-old son, and his response to everything is, well, GPT said this.
Yeah.
But we've got a lot of resources to learn about our own body and the different kinds of therapies that are out there. And so, you know, I think social media has done our profession wonders, because it brings transparency to professions and what we actually do. You know, back in the 80s, there was the American Medical Association. They developed an anti-quackery committee to disband and discredit our profession, and that's partially because back pain is one of the top things that comes into a medical doctor's office. And so a group of chiropractors ended up forming a class action lawsuit against the American Medical Association because they produced propaganda to discredit us. And That's why often we're referred to as quacks or we're selling snake oil. It's because of the propaganda from American medical the medical
Yeah, it's
doctor
called the
community,
Wilkes
you know?
case.
Yeah, the Wilkes case.
The
Yeah.
NCMIC, like insurance company, I think they put out a 3-part like webinar series about that a couple of years ago. Did you see that?
I didn't.
And so how it came about was it came from some Scientologists that had infiltrated the FBI, thinking they were looking at
I did
them.
hear about this.
And
yeah.
then so you had these Scientologists that had infiltrated the FBI and thinking that they were against their church, and they realized, well, these people really don't have anything against us, but they sure don't like these chiropractors.
Yeah.
And then someone on there got some files. They had the whole committee that their whole purpose was to eliminate chiropractic. So the Scientologists that infiltrated got these files and they gave them to the chiropractic profession, which is what started, and then almost got dropped because I guess it just getting passed and no one was really picking it up. And then that is what actually brought on the Wilkes case.
That's amazing.
Crazy. I just watched like this series. It's like almost something out of a movie. It's
That
like
sounds like a movie.
Yeah.
You know, I love medical doctors, and I have nothing against them. I was gonna be a medical doctor.
Mm-hmm.
You know, that's what my plan was after my surgery and coming out of that process. I owe my life to an orthopedist who did that surgery, and you know, there's a place for drugs, there's a place for surgeries, absolutely, but there's always going to be some bad actors in every profession.
100%, and along with ours.
And so, you know, when those get exposed, it's important because our name kind of got dragged through the mud for years going through that process. And I think it comes down to is that the other healthcare professionals don't exactly know what we're doing. You know, they don't, you know, we ain't just cracking backs and hoping that their diabetes go away.
Yep.
We're looking at the whole body.
Yeah.
You know, we want to know what they're eating. You know, we get a lot of education in nutrition too. And so, and that's one of the missing pieces with the MDs and DOs is, you know, how much education are they getting in the kind of the conservative therapies, you know, versus the pharmaceutical therapies. And so there's a long list of ways you can help the body without pharmaceuticals.
Yeah, and I always think, you know, you go to the hospital because you're in a crisis and you're just in survival mode. You go to a chiropractor because you're really trying to get healthy and stronger and rebuild your body. It's just different. It's just a different focus, and there's a time and place for everything.
Yeah, everyone's got their own responsibility of looking out to see what's best for them. If you want to assign that responsibility to somebody else, you better be damn sure that somebody else knows what the hell they're talking about. And so if you have a problem, there's all the resources in the world, especially with artificial intelligence now, of how are you going to approach this condition?
So on that note, if someone's watching this and they're looking for a chiropractor, how do they find you guys and learn more about what you guys do?
Yeah, I think it's good to do your due diligence, and you know, online reviews go a long way. And so that's just like if you go to Amazon, you know, and you're looking at products to buy, you're always looking at reviews, and that's where you get the dirt, right? What's the good and bad about stuff. And so take the time and read reviews, and you shouldn't go to the person that's just because they're the closest.
Yeah, 100%.
Gosh, you know, that's the worst thing in the world. You know, I know you get people that come from out of the country and out of state to come see you, and that's been the case here too. You know, we'll have people. Sometimes I'm kind of
Sometimes the person that comes in, how'd you pick us? Oh, you were the closest. That's almost the ones I don't like. I like the ones that have actually looked a little bit.
Yeah, because those ones are not as invested.
Yeah.
And so yeah, you want a well-educated consumer that's coming to you that has done the research. It's like, oh yeah, you offer X, Y, and Z. That's very specific to my condition. I think you're the exact person I need to see. I've read your bio, I've read all your reviews, I've gone through all of your website, I've looked at all of your social media, I've looked at anything that's online about you. I looked at your reputation, I've talked to my friends about this too. And so there's a lot of different resources for people to find what they need. And so, yeah, as far as like scoliosis, if I had scoliosis, I'd go to a guy like you.
Well, thanks. I appreciate you saying that. And you guys if you just look up Denver Chiropractic, you're probably going to come up. And then where are you guys located?
We're located in the Highlands area in North Denver, 39th and Federal. easy access.
Is all your social media Denver Chiropractic?
Yeah, Denver Chiropractor. If you just type in Dr. Trent Denver, there's going to be a bazillion things that have come up. I've been very open about my life and about what I do here because I want to be transparent. And so I appreciate you taking the time to come here and learn about this practice and also for me to learn about your practice too.
You bet.